We are going to start our panel discussion. We have some wonderful speakers here today, including Jose Rodriguez, Dr. Michael Pera, Dr. Howard Fradkin, Don Laufersweiler, and Dwayne Steward, and as well as Teresa Long, who we heard from earlier today. So if you all would like to briefly introduce yourselves and describe your background and how HIV has impacted your personal and professional lives, just very briefly to start us off.
Sure, I think I can do that. My name is Jose Rodriguez, and I am Community Relations Director for Equitas Health. I actually have played many roles in public health, and I have a great relationship with all of my fellow panelists today. I actually have either worked with them, worked for them, or done all kinds of fun projects, so I could not be prouder to be sitting among them. So I'm looking forward to the conversation. Thank you, and I will send it over to my old boss, Dr. Long.
Well, hi there. Thanks, Jose, and thanks, Maura, and thanks to SDES for giving us an opportunity to both think, reflect, and also to think forward at the same time. So I appreciate this. And actually, it's great to see the other panelists. I too have had some experiences and longtime connections with them. So I'm so glad to see you. So I come to this, I am working at OSU in the College of Public Health as a special advisor, but I did start my career in medicine and in public health in San Francisco, late 70s into the 80s, and actually came here to Columbus in 1986. One of my goals was to establish a public health community AIDS program. So that's some things to reflect upon how far we've come and how I had the opportunity to work with all these folks and stayed with Columbus Public Health until the very end of 2017 when I retired.
Very nice. We can hear from Dr. Pera next.
Hi there, I'm Mike Pera, and I am delighted to be here today. A lot of you are my friends, and I've worked with you for a long, long time. I one time told Teresa and Jose that I knew about AIDS before anybody else did, because one of the people I worked with in Chicago called me before I came to Ohio State in 1981. And he worked at the CDC and started asking me about unusual infections and what viruses could cause unusual infections. And this is Harold Jaffe. He later went on to head the HIV section there at the CDC. And so it's been a while that I've heard about it, and I came here, and because I had trained in virology and infections, I was specifically interested in kind of infections in cancer patients and transplant patients. And when HIV came along, I was given the assignment to talk about it to the physicians in the area. And then in 1983, we saw the first case at Ohio State. And then I realized that this was going to become a bigger and bigger problem. And because it was growing so rapidly that I basically devoted the rest of my professional career to HIV care and research. That's enough.
Yeah, we can move on to Dr. Howard Fradkin next.
Good afternoon, everybody. And like everybody else on this panel, I'm thrilled to be with all of my friends and colleagues from the past and still present. I learned about HIV actually when it was called GRID, gay-related infectious disease, back in the early 80s. I became involved with the Columbus AIDS Task Force, helped to found that in 1984, was involved in providing support groups for HIV and AIDS at affirmations, helped to create the Ohio AIDS Coalition, and led 15 weekends of healing weekends that involved all sorts of different practitioners. and worked in that field for a long, long time. So met some incredible people and gained a lot of wisdom about life and the meaning of community during all that time. So thank you.
I'm Don Laufersweiler, and again, it's good to see everyone. I've been out of the way for several years now, as I retired in 2013. I started in HIV AIDS work in Marietta, Ohio, Washington County, which, although it's a large county, it's not very populated. And we started having people return from New York City, San Francisco, being sick, and it was the time of grids. So they would be coming home, typically no one knowing what they were doing, or even that they may be gay. And I was the director of crisis intervention and chemical dependency services at the local mental health center. So with that background, I was in the right place to begin to work in this area, and being a gay man, it also just obviously had a personal feeling. I became the notifier in the area when we started having testing and people showing up in the hospitals. The health department would contact me, and I was the one who went to the person to let them know what was going on back in the early 80s. I ended up in Columbus about 1990 when Howard and I became business partners at Affirmations. I also had a specialty in chronic illness, mentally ill. And so that put me in another spot to be prepared to deal with HIV as it happened. Good.
No, it's great to have you here. Could we move on to Dwayne next?
Hello, thank you all for having me back. I am Dwayne Steward. I'm currently the Director of Prevention at Equitous Health, where I lead a lot of the HIV prevention, education, harm reduction, and LGBTQ population health work across the state. I first learned about HIV really as a teenager in the 90s. Sadly, my first encounter with HIV was shrouded in stigma as being a part of the church, and one of our members of our congregation passed away, and there was lots of secrecy around this person's death. And I, being a very inquisitive teenager, which continued throughout my adulthood, started asking lots of questions. And being in the responses that I was getting, also at the time being a teenager who was discovering their own sexuality, trying to understand what this has to do with me and why there was so much stigma and really a lot of hate around the subject. And going through college, and I've always just been someone who's really taken to studying African American history and LGBTQ history, as I find my identities are at those intersections, and just throughout college studying all the amazing work of the community mobilization that really took place around this, and decided that I really wanted to be a part of this movement and this work, and kind of even though I was starting my career in journalism, really at newspapers, at writing, and doing a lot of work of talking about the marginalization of people and trying to tell people's stories, realized I wanted to do something about it. And so that's when I started volunteering at that time at the Columbus AIDS Task Force, just before it became AIDS Resource Center Ohio, and just started testing people as a testing volunteer, and realizing at that time, this was in kind of the mid 2000s, that the face of HIV was changing, and a lot of people that looked like me were the ones being most affected. And so I felt like I needed to do more. And so I started working at AIDS Resource Center Ohio with really the focus of making sure that that communities of color and those who are marginalized and transgender communities are really becoming a part of this fight, and becoming that they weren't being left out of the conversation. And so that's what got me involved, and why I continued, basically devoted my public health career to this, and now I've been doing this for around 15 years. So I don't see myself stopping anytime soon.
Yeah, and like I said earlier, it's great to have you all here. You each offer like a very unique perspective, and I think uh, having you all in one place is going to be a great discussion for us. So I know, Jose, we kind of talked about who wants to like ask the questions to the panel members. Either I can do that or you can do that if you'd like. I'm fine with either way.
You know, I think we could both do it.
Yeah.
You know, I realized that after I said who I was, I didn't give you a little bit of my background. So I'll just go back to the first time I heard about HIV. And I remember exactly where I was. I was at a friend's house. His name was Boyd. And I remember it was a Saturday night because we were watching the Golden Girls. How about that? A long time ago, the Golden Girls used to be on a Saturday night. And I remember my friend Boyd, and this matters. So he asked me, are you afraid of this grid that we hear about? Now I was in the Pittsburgh area. And I said, I am not afraid of it because I'm not in New York or San Francisco. So that gives you the lens into the naivete that many of us that were in the, I guess Pittsburgh is kind of East Coast, Midwest. We didn't think it could happen to us. So, and within a year or two, we were having friends that were being impacted and being, you know, coming down sick. So one of the reasons why I was really excited about this conversation is because I think a lot of the panelists here bring a sense of what it was like. And I think I asked this question of Dr. Kolitar earlier at a session, and I think we can start with that question. I'm gonna hit, Mike, I'm gonna hit you with a tough question. Or Dr. Parra, I'm gonna hit you with a tough question. But I asked Dr. Kolitar, what was it like to be a physician when you're working in a field? So put your physician hat, not so much your researcher hat. What was it like to work as a physician in a field in which you know that most of your clients or patients were gonna die? I mean, how did you give them hope, and how did you find hope yourself to keep on doing what you needed to do as a provider? And I realize it's a tough question.
Yeah. Early on, Jose, I don't think it was really clear what the natural history of this was. We did know that there were people who had some minor manifestations. Remember, it was called AIDS-related complex. So people would have thrush or swollen lymph glands. And we knew that there were people who were very sick and dying, but was everybody who were in an earlier stage going to end up in the later stage? If we treated the infection in the later stage, the pneumocystis pneumonia, would they do okay for a while? And so, you know, there was always hope that we would learn more and more and be able to help people more and more. It wasn't, I understand that eventually, you know, as time went on, it looked like this is certainly a death sentence, but it had an indefinite time. And so I would always look at, let's treat this problem now, or as best we can, and hope that something better comes along for next week or the next year. Let's keep working at it. Things are gonna, you know, we were understanding these unusual infections better and better from literally week to week almost, and how to manage them was getting better and better. And so people were living longer simply, even before the AZT era, we were doing better at treating individuals. Somewhat like COVID, where you know, it was certain if you got on a ventilator, there's a 50% chance you're going to die. Well, now there's not that big a chance because we were learning things. We were learning how to manage people better. And so, you know, I that's what I tried to get across to individuals was that there is hope here. And we just got to deal with the problem as it arises today. And hopefully things will be better as we learn more tomorrow. Not that that was easy. I mean, I had to say that the reason I went into infectious disease to start with was that it was treating complicated patients with unknown things and curing them, because that was why I didn't go into oncology. I had that experience with dying patients all the time, young dying patients, and I didn't want that. And then I got into infectious disease, and well, into this area, and was doing just that. I had to learn.
So Jose, do you mind if we all jump in where
Please do.
I think we can add something to it? That's what I was thinking. So Mike, I salute you. And you were right there on the front lines in the beginning. I remember rounding 1980, 81, 82 at San Francisco General Hospital when at first we didn't know anything about what was going on. And then we knew a little bit, but it was a very scary time in the beginning. Because we didn't know how it was actually transmitted. And so the fear, and I would say, you know, Jose, you asked about the medical professionals, at least in San Francisco, and I can't imagine it was any different, it was scary. And honestly, the partners, the loved ones, the families were also very scared in the beginning because we didn't know really how it was transmitted and not transmitted. And honestly, it was the partners, the family members. I think we'll even talk about the power of the LGBTQ community, the lesbian, who stepped forward and said, we're going to provide whatever kind of support and family care we can. At the same time, I watched a lot of medical professionals, some say, I'm not going to do this anymore. And others who would put on chainmail gloves and say, I'm going to do whatever the surgery is, I'm going to do whatever I have to do to take care of my patients. And so people kind of stepped forward, supported each other. And just as Dr. Pera is saying, we learned a lot. We learned a lot, but it was scary. And of course, I think we'll talk more about scary, shame, stigma. All of those things they're not good for your health. I'm sure we'll keep coming back to that. But it was a scary time, at least in San Francisco. And I'm sure the same in New York and LA, where these first cases were thought about. And I'm sure when Mike's friend Harold Jaffe, I mean, it's intellectually amazing, but it's also scary when you're not quite sure.
Yeah, you know, just with respect to the fear, is that I never, not that I'm brave or anything like that. It's just like this is a bloodborne. I mean, we already knew from the very beginning, within the first, you know, and that was one of the things. Like within a year, the CDC said, "This is what you need to do." Healthcare professionals, maybe not even a year. This is what you need to do to protect yourselves. And yes, they were dropping meals off on the outside of the patient's room, and I'd have to carry them in. But really, I always felt this is a sexually transmitted bloodborne disease, just like hepatitis B. If it's going to be transmitted through the air, it doesn't matter anyhow. We're all going to die. But I just couldn't believe that was the case, and so I tried to bring that across too. I mean, but it was. I mean, I noticed Jose talked about misinformation. Honestly, people were frightened, but it wasn't like now with COVID and everything else, where it's just a bunch of mouths talking misinformation, giving people bad data. It was scary, but it wasn't bad data. It wasn't like the opposite of what you think it should be.
Howard, do you want to talk a little bit on Dawn about the impact of all those things on the psychic of the LGBTQ community? And Howard, Howard and Dawn, just something really important. Howard and Dawn facilitated a support group for sometimes 20, 30 people on a weekly basis. So that was a really microcosm of the epidemic, I think, of what folks were going through. So I was wondering if both of you could talk about that.
Well, even before that, I was involved with starting the Columbus AIDS Task Force, and I started the support services committee of the Columbus AIDS Task Force. And so from the beginning, we started having contact with Mike Para and other doctors in the community as we developed a buddy system. And the buddy system was, as Teresa said, it was gay men and straight men and lesbians and allies who were willing to go to people's homes and go into the hospital. I mean, people were scared and at the same time were so committed to wanting to be there for people in the community who most of them, didn't know these people. They, they may have known somebody else who had AIDS or HIV, and they just wanted to be there to help them. And it was very difficult at first. I mean, we'd walk into the hospital, and early on, patients were getting their food delivered at their door on a tray. They, the food service folks wouldn't even come in the room, and the nurses were like, "Oh, you have to put gloves on, and you have to mask up, and you have to have a gown on," and our volunteers were like, "No, we don't. That isn't how we're going to get infected." By that point, we had some idea how we would get infected, and so we wound up having all these kind of discussions with the staff, and finally got to a place where we could provide services in a way where we could really just sit on the patient's bed and be there for our buddies and help them. But it was very emotional. I mean, when our support group started, I mean, we advertised it, and one or two people came, and then we waited, and then a couple more came, and then eventually a few more, and then there was a point where almost everybody who had come to the group died.
Yep.
And that was tough because then it felt like, well, what hope can we provide them? Don?
Yep. I can remember that point when everybody had died from the group, and we sat there with one person for several weeks. We kept looking, saying, and he was new, he was from California, and we kept looking and saying, "Don't worry, they'll be back." And eventually they started coming back. And that was very important. And then, Jose, that's the group that you're talking about that eventually went into as many as 30 people. And we had to close our office and separate into 3 separate groups, and had Dr. Jim Hodnick come in and help because it took the whole place. And to go back further, back to when I was in Washington County, many times I called Dr. Para and said, "What's this? What's that? What can I do next?" Because although I knew many of the doctors in town, they had as little information as I did for the most part, and they were learning. I can remember the first diagnosed case in a hospital in Marietta, and the doctor pulling the guy aside into a very small little broom closet saying, "I don't know what this is all about, but I think you've got this HIV thing, or this AIDS-related complex thing." And sure enough, he was the first person in the area who got tested too. And I had the benefit of going up and explaining it all to him. And one of the things for me in the stigma area that happened is when I would go to the hospital for any reason, if I was talking to somebody in the hospital and the doc saw it, they would assume who I was talking to must have HIV. Not even with ever discussing it with the patient. It was and I heard once a doctor say, "By the way, patient in 317, be cautious. He's probably HIV positive." the reason he assumed that was because I was there visiting. So those, those were stigmas within the hospital that I dealt with. And it created a lot of, obviously, guilt by association, but, stress and being private about visiting and just being sure that we could have some confidentiality when some of the people were just there for other reasons. I also, started with the Ohio, Howard and I met because we were both on the board of the Ohio AIDS Coalition. And we started the healing weekends to back in the mid-'80s. And so that's sort of how, well, I met all of you, but that's how we ended up becoming partners and becoming really good friends.
And that's part of how everybody, I think, found hope, because it was just having that connection with each other. I mean, maybe misery loves company, maybe, it's just having the opportunity. There was so much shame that having the opportunity to be in a room, because most of these people were pretty isolated and didn't know other people with HIV and AIDS. So to be in a room where there were other people who were struggling with the same thing, whether it was the shame of the disease, the shame of how I got it, the shame of, my parents are going to reject me. Many of them were dealing with friends who were rejecting them, who just didn't want to be around them because they didn't want to be reminded of, particularly early on, when people were wasting away, or when they had Kaposi sarcoma and there were big spots all over them. It was things they couldn't hide. And a lot of them isolated and didn't want to be around anybody. And Don was reminding me the other day about at least one guy who came to our group who wore shorts and a t-shirt, and he was just like, I'm not hiding. We needed people like that, who were able to see the possibility of hope. There was one day in our group when a guy named Chuck, it's one of those horrible nights when everybody was down and depressed, and finally Chuck says, well, I don't know, I think we need a contingency plan because, maybe we'll live. And it was like this turning point in the group. I mean, many people got pissed off with him. They're like, how dare you suggest that? But on the other hand, it's sort of like, oh, we hadn't even considered that as a possibility,
I can remember in the group, many people being upset with the concept of maybe not dying. And I think part of it was not a lack of hope. It was just their frustration with the fact that nothing was telling them, except for some people with good confidence, that there was a possibility that people would get through this. And this is a late 80s, early 90s. And I've more than once had someone look at me and go, how could you say that? How can you say that there's a possibility you can survive? I just had to look and say, I'm going to keep saying it.
I remember taking my friend Matt to Dr. Parra's clinic at Ohio State. It was the old building. And in the early days, of course, it was a terrible little space. You folks were crammed into this little hallway. And I remember walking in there and finding somebody that I would later on became friends with. His name was David, and many of you know David. But he had KS all over his body. And he was in really, really bad shape. And if you don't know what KS is, it was Kaposi sarcoma, which was a type of skin cancer that would basically deform you. It was supposed to be very painful, I think, but it was mostly deforming. So it was painful to the soul, if you will. And being so terrified when I saw him and being just terrified. It took me forever to ever come back to that clinic, because he was like it had hit me in the face. And it was part of that stigma that many people towards the later stages of HIV would see, that those deformities, and I'm not sure that's the appropriate word, but the impact on the body was definitely traumatizing. And it was hard in the gay community to be a gay man and be faced with that on your face all the time, because everywhere we were going, those were the images that we were seeing. So that those were daily reminders for those of us that were living in these circles.
Kind of going along with that, I just want to open this question up to anyone who'd like to answer. But I just wanted to ask what it was kind of like to be an LGBT identified person in Ohio as this was occurring, and even like into the 90s, as it was continued to be stigmatized, even as treatment was developing.
Well, I think one of the things is that, at least for me, I was already out of the closet for 10 years. So I came out in the mid-70s. And, you know, it was one of those things where I was an in-your-face person when it came to you know, LGBT information. It was like, as a matter of fact, I almost lost my job because I went on PBS in Southern Ohio to talk about gay issues back in the early mid 80s. And at that time, so, you know, for me, it was just a continuation there. I'm not exactly sure how that changed that. It just became more obvious, and you had to be a little bit more demanding, and well, a lot more demanding. And you had to be sure you just couldn't take the shit.
Yeah, I'd agree with that. I was the first openly gay intern at the counseling center at Ohio State. There were gay staff there who were in the closet, but no one was open. So, and then I got involved with Stonewall and the beginnings of that. So I was pretty open. So
then they graduated you.
They did. So in some ways, being gay in the late 80s, 90s, for me was exciting in the sense that I felt like I had something to contribute, and I really had a lot of influence. I mean, the Ohio Department of Health was very progressive back even at the beginning of the AIDS epidemic. I mean, they hired Buck Harris as the gay health consultant, and Buck was instrumental. I mean, when testing became the reality for Ohio, they pulled together all the people, all the leaders of the gay community, and we did a retreat up at Mohican State Park. And they asked us about how did we think the gay community could be helpful in terms of helping educate our community. I mean, we talked a lot about how to promote safer sex, you know, which you know, I think about today about the pandemic and wearing masks, and I think about what we went through to help the gay community to learn to wear condoms. And, you know, in some ways it wasn't that hard. I mean, you know, and in some ways it was quite difficult, but that required to me a lot more sacrifice than putting a mask on your face and washing your hands. But again, the gay community really pulled together, and the lesbians and bisexual folks. I mean, it's like we all pulled together and knew that this was a life and death situation, and we couldn't hide from that. And so, in some ways, it really pulled the community together. So, in that way, it was exciting and invigorating, and also painfully, dramatically difficult. Facing all that death for so long.
Dr. Long and Dwayne, I wanted to hear Well, first from Dr. Long, I would love to hear a little bit. What did you learn in San Francisco that you were able to bring to Columbus with a public health lens? What was that intelligence that you brought that helped us move forward? And you're muted, Teresa.
Gosh darn, I'm so struck by what I just heard Don and Howard saying. And I remember hearing about that meeting at Mohican. And it's actually nice to hear something nice said about our state health department. So good to have those thoughts. So San Francisco, and I mentioned the fear, there was so much interest and learning. So I learned a lot, and I think we all did. There was zero doubt that the power of the broad LGBTQ community was amazing. And I don't think they necessarily realized all of that, but it came to be very important. And I guess I've thought a lot about it. I mean, there's a whole spectrum as far as how I learned, and I think many of us learned about how to intervene and how to ideally think about prevention as well. But it did start with the individuals themselves, the individuals who are being impacted and their loved ones, their caregivers, et cetera, and working with them and strengthening their understanding and their knowledge and skills. But it clearly then broadened to the entire LGBT community. And we had to educate healthcare professionals. And Mike talked about one of his early roles here was to educate primary care providers. They were not interested in providing care. That happened in San Francisco as well. You know, we'll find one or two physicians at a hospital and they're going to provide all the care, which was impossible. So that was a huge thing to try and build, and a lesson to learn about how could peer physicians educate and support their other peers to provide care. And then I think some of the biggest lessons for me came around how to organize and how to think about working with allies, and ultimately how to change policies, both policies in organizations and then obviously policies in a community or in the country. And there's no doubt, and actually I heard one of the speakers earlier today talking about the power of ACT UP, which is no doubt was very powerful in all kinds of places. The AIDS Coalition to Unleash Power. And they were amazingly effective at, shaking up our federal government and our local community. I'll never forget them shutting down the health department where I worked, the San Francisco Department of Public Health, and shutting down the Golden Gate Bridge. I mean, they also shut down NIH and Wall Street, but these had huge impacts. And the part that many people may not have fully appreciated was the power they also held, which was to send around some of their members who were very strategic to then work with leaders and say, okay, here's what we really have to have. We have to have more money in research. We're going to continue shaking you down until you work with us, until you recognize us as a community, until you treat us as partners, until you think of us not just on one aspect of either, well, maybe not. I mean, they wanted more medical care and more research for sure, but you have to support us. So again, coming to Columbus from San Francisco, there was no doubt that, I needed to meet Mike. I needed to get to be friendly with the Columbus AIDS Task Force at that point, which was very small, had a very part-time presence, but a lot of volunteers. They were amazing. But also to think about kind of where we were with data around the community and how could we build programming that would both educate the community and support the community and understanding and the prevention side, just what Dwayne has been all about, but also be very supportive of persons who had HIV and services for them, as well as for those who cared for them and supported them. So I think there were a lot of lessons that I was able to bring. And I'll never forget, the very first time I talked publicly about this plan, I was shocked. I mean, it was the first time I had radio stations all over me. I'm like, really? It doesn't seem that surprising. And yet that was news in Columbus. And it got a lot of attention. And honestly, we were able to, from then, get funding. And we got funding that both provided for programming at the Public Health Agency, but also provided funds that we then use to provide support for services in the community, supporting residents of Columbus, at least in Franklin County, to go to the healing weekends that you've just heard about, to provide support directly for the Columbus AIDS Task Force and what they were doing and what they wanted or felt they needed to do. And then ultimately we were able to provide money to grants to many different agencies. So again, I think there was a lot of lessons learned around organizing and then how to think through. And I'm sure we'll talk about some of the policy issues, and, policies that at the Columbus City Schools, that was one of my very first. As soon as they heard that there was one of their staff who might be gay, they would not allow them to be in the classroom. So that was the first thing, to go after the schools, but ultimately going after, and really Mike provided strong leadership in working with our state policy around creating something that was protective of privacy and confidentiality, but also set up kind of structures around prevention and education and service, but really around protecting the rights of persons infected or believed to be infected. So I'll stop there.
Thank you. I was going to ask Dwayne. Dwayne, if you could talk a little bit about those lessons learned from what you learned from the past and how you put those in use now to manage prevention. And then I would love to hear from Dr. Pera after that about, Mike, I know you were instrumental in making sure that testing was kept anonymous and driving that law in Ohio. So the impact of that policy in getting people tested out, I know you were critical in that effort. So Dwayne.
Yeah, there's many things that I think we've learned and continue to build upon today in the modern kind of fight against AIDS. There's been kind of, for me, there's like these three waves within the historical context of HIV. There's, the stories you all tell about the kind of beginning and how it started, and the stigma, and how the community kind of had to mobilize around each other to actually force our government to do something about it. There's that story, and I feel like there's also kind of my generation of folks who, who grew up in the 90s, who haven't ever experienced a world with kind of before HIV, or that a world without HIV, and how we've kind of become activists in this world, and how we experience HIV as kind of just being a thing that's always existed, and how that kind of has colored the conversation and how we address the fight as well. And then now we have like what they're called Gen Z now, the folks who are kind of coming into college now, and they are seeing PrEP and U=U and all these different things that now exist, and they feel like HIV isn't really a problem anymore. We fixed it. It's and I have youth who tell me today, why are we still talking about this? But also not seeing that even throughout these threads, there are folks who are kind of been traditionally marginalized or haven't had access to care in our healthcare systems, have been the folks who have continued to be the most affected throughout all of this, I feel like. And so now today I feel like the HIV fight has really now come right next to just the larger health and equity fight that we're having across the country, of how do we make sure that folks who are traditionally kind of left out and traditionally don't have access to healthcare, how are they now, how do we make sure they have access to the science and the tools that have been created? And I think because of that, we've kind of come a bit full circle, because we have this group of folks who feel like HIV is not an issue anymore, but then we have this other group of folks who really need us to do that kind of grassroots work to make sure that they're getting access. We're starting to now, I feel like, borrow and look back to the beginning of the fight and how we mobilized and got this information to folks who had never heard it before, or how did we bring people in and make them believe and understand and and think this fight is important. I think we're going back to that a little bit. And so I told a story when we were originally kind of having the conversation about this panel, just about the work of Howard, Fradkin, and Don, and how they did all this amazing work to start these support groups kind of at the beginning of the pandemic or the epidemic. And now during the work that I do now, just in the past couple of years, we've had to kind of bring back those support groups because of the need for people who are young and still becoming who are seroconverting, becoming HIV positive today. We had what we called a living positive weekend, and there was a trans woman of color who came to that living positive weekend, and by the end of it, she was in tears because she was just like, it was happy tears, like she was so excited that there's this space that existed, that other people were HIV positive like her. She was a trans Black woman in her 20s, and who never talked to anyone else that was HIV positive, and had her diagnosis for 2 years, and just felt alone. And the fact that we were able to bring her to this space, she was able to feel immediate community and feel like that she could actually fight this, and wanted to get into care and take care of herself, and was learning about all the medications and the ways that she could take care of her health, and all of that the structure for how we were able to build that weekend, and that's positive support, was built by the people at the beginning of this pandemic, or I keep saying epidemic, the beginning of this epidemic, like the people on this call. And so I like I said, I love history. I'm a history buff myself, and so I always feel like it's important for us to continue to learn from the past, and from our mistakes, and from our our accomplishments, and I think that again, like I said, I think we've really come full circle in this fight in many circumstances, in the work that I do today.
Thank you, Dwayne. Dr. Para, do you want to comment a little bit on the fight to make sure that testing became anonymous in the state of Ohio? I know you worked with Congress on that. And you're muted, Dr. Para. You're muted.
I beg your pardon. The test became available in March of 1985. And so one could get this test. It was created actually to screen the blood supply, and they started using it like on March the 5th of 1985. I had somebody infected on March the 4th from a blood transfusion. And you could identify somebody who had it, who could transmit it. So the public health need is to identify as many people possible who have it, and tell them to practice safe sex, so it wouldn't spread. Well, at that time, there were really no treatments. And so if you were feeling fine, enjoying life, do you want to take a test that tells you might die at that time? Again, death was getting a little bit more clear as an endpoint. Is that what you want to do? And so it was difficult, and that was the reason Tom Halpern at the State Health Department kind of worked with Buck about getting the test out there in the right context, having these support groups talk about it. But the last thing you wanted is to have this get out of your control, so that if you wanted to know so you could change your behavior, or help you change your behavior, the last thing you wanted is a bunch of people at the health department talking about it, or anybody else talking about it. So you were very reluctant, and you knew that there were people like as usual, there were nutcakes in Washington about let's test everybody, and those that are positive, let's send them to an island in the Caribbean. Or let's segregate them, or you know, isolate them. And the last thing that somebody who's having a difficult time needs is to be isolated. And you know, that's the whole thing that everybody's talking about here. You have to, when one has a serious illness, they need support from others. And so, and I'm going on and on, Jose, I'm saying everything that everybody else said. But basically it was, they had to keep the test anonymous, or people would be very reluctant to get tested because they know it was going to go to the state, and then the state was going to turn into the CDC, and they do turn in names to the CDC. Now they're coded names, but and so that was the reason that it really did. If we wanted people to get tested, the last thing we wanted to do is to tell them that we want your name. Not every a lot of places took names. I remember some of my friends from Denver saying, last month we had 142 Ronald Reagans that got tested. You know, anyhow, and so I there was a urologist in Springfield who was talking to a state representative, Dave Hobson, who eventually went to Congress, about the importance of this. And I would talk to the urologist, and he would talk to Hobson, and then eventually Hobson would talk to me about this and getting this through. And he was a widely respected Republican legislator. And so he worked with the health department, and you know, intermittently asked me some questions, and developed the AIDS bill at the time, which was one of the more progressive bills. That is, that, you know, it kept the anonymous testing going. And so it was really, it was part of the whole preventive health effort, public health effort, to get people, and again, like, you know, even when there were treatments, people didn't want to know. And that's the reason we have pushed more and more, is let's get people tested so we can get them in treatment, because the treatments are getting better and better. And that was part of the motivation as well. I hope that wasn't too rambling.
No, Mike, you actually, that's exactly who I was talking about, was Hobson. I could not think of his name, but I remember you giving him an award at Ohio State and speaking of the significance of that bill.
Yeah, no, it was, I mean, it was amazing for a Republican legislator to stand up for this, to do the right thing.
I would just, oh, go ahead, Mike.
No.
Well, I was just going to add, especially for some of us that think that just good science should get us good public policy. That's clearly not how public policy really happens, or at least certainly not most often. And so, you know, Mike sharing the story of the urologist who had a connection, and then Mike being able to support that, that's super important to realize that we need to get relationships. And I talk a lot about advocacy around policy. So we'd like to think it's just good science, and that a good researcher and good science and presenting that to a legislator would create the will to get it done. But that's certainly not enough. And so having a personal connection like this urologist was super important.
Right.
And I remember, because this was on the House side, when it went to the Senate, and I'm blanking on the senator's name. It was a lady who was the chair of the health committee. And she too was like from Dayton, Montgomery County someplace, but a Republican. And we tried so hard to get her to understand all this. And it was her across her back fence neighbor who, and I don't know if the person was LGBTQ, I think they had a son or daughter, but they started talking to her about how important this kind of protective legislation was. And it was really that. It wasn't all the information. It wasn't the draft or the model legislation. It was really hearing a personal story, how it would impact, you know, the son of this neighbor that gave her the push to say, I have to provide leadership to get this happening. So the power of the story and the power of relationships, I think, has always stuck with me. And that's been a really good example of that.
Right. And, you know, I had similar experiences down in Washington County where I can remember one night during this discussion in Hobson working on the bills and whatnot, my phone rang and it was one of the local state representatives. And he goes, I was told you're the guy to talk to about this HIV/AIDS bill. And, you know, how he found me, I don't know, because it was so early in all of this. But somebody told him and he found me, and we discussed it for about an hour. And I think that was the same week that the votes came down on the bill. So, you know, they were looking. And that's community. It was about community. You know, he reached out to me. I didn't reach out to him in that case.
Yeah, and I think that also connects with the quilt and how like the power of stories about people's lives can influence how people view diseases like HIV. I just want to ask about the quilt. We have about half an hour left. I just want to open it up to anyone to ask how did you become involved with the quilt, if you were involved with the quilt, and how did you connect with others interested in creating and displaying panels?
I think the Columbus AIDS Task Force really provided the impetus for local people to start creating quilt panels. And it became a very, and I remember working on one for a friend of ours, and how it was such it was a ritual, really, a way to be able to, because many of us didn't have a chance to say goodbye to people who died for a whole host of reasons. And so it gave people an opportunity to say goodbye and to commemorate their life in a way that helped them, you know, that you could put, you know, 30 different pictures on a panel that represented your connection to that person, and that everybody who was friends with that person could do that. Was critical to that healing process. I still remember going to see the quilt with my partner Pete the first time it was displayed in DC, and initially, I mean, it was huge, however, and then it became larger and larger and larger. But just that very first time, I can hardly even describe the words of how that felt to see in real life, in a real moment. You know, they had all these support people lined up all around the quilt to help people, because it was just totally overwhelming to see that much loss. And again, that was at a time when you know, Ronald Reagan was still president, I think, and he wouldn't even say the word AIDS when we first started all this. And so it was extraordinarily important for our community to have that ritual and have that way to say goodbye. And each time we went to see the quilt, when we got to bring panels of the quilt here to Ohio, I think they hung it at the Vern Rife Center. And there were several other places. I'm pretty sure Ohio State brought panels at some point. So again, each time that it was displayed, it was so important. And, you know, many times I'd go to see the quilt and I was like, it was a name of somebody I had no idea had died of AIDS. And to see their name was startling. So it was extraordinarily important, and again, you know, really emotional and tough.
Do you remember it was at Woody Hayes? I think it was shortly after the Woody Hayes Center there on Olentangy Open that they had it there. And now I can't, I mean, that had just opened, that facility, so it had to be in the early 90s or late 80s. And
that's right, Mike.
And it was the whole floor. I mean, you know, it's the size of a football field in there, or a little bigger actually. It was the whole floor, and the walls were covered with quilts. Yeah, it was. You know, it was really. As I walked by and saw people, I took care of him, and then I didn't know what happened, and it was very, very difficult for me.
It was life-changing, but I remember going to DC and turning in the quilt of two friends. I was fortunate to go to DC twice for two exhibitions, and both experience. I was also at Ohio State. I went to the exhibition there. I think the DC was definitely, for me, it was life-changing. But what it did give me was a sense of comfort of when we were pulling the quilts together and the friends would come together on a Sunday night. Again, the conversation about here is about building community. So you think of, well, how do you survive this? You survive it by building community when the community is falling apart around you. So it was a way of supporting each other. I remember working on the quilts for, oh my God, for over 10 people. And then there was a sense of comfort in doing that work together and kind of celebrating their life in the midst of so much misery. And if you ever make it to San Francisco, I think it's important to remember Cleve Jones, the founder of the AIDS Quilt. And you can actually go to Market Street, and on Market, you will see the house where the first quilt was ever exhibited, and the window of the house, which was, you know, the guy did a quilt for his partner. And if you look at the size of the size of the quilt is actually that of a grave. So there's a great historical component to it. And every time I go to San Francisco, I still walk by.
Yeah, so I would jump in there too. It was amazing to be there. And Cleve Jones, I think he just passed away in the last year or so. But he was quite a gay activist. And my understanding and recollection of the quilt being born was coming out of a horrific event that happened in San Francisco in 1978, where our first openly gay supervisor, because San Francisco is a city and a county, so they combine city council and commissioners, et cetera. So Harvey Milk and then the then mayor, George Moscone, were murdered. And it was horrific. I mean, everyone was horrified. But the gay community continued to have at least an annual vigil to recognize the passing and the horrific assassination of these men. And especially because a gay man, you know, who everyone had celebrated had just been so horribly killed. And the story I recall is that Cleve remembered in 1985-ish, you know, asking people to put up names of people on cards who had passed away from HIV at the end of one of these Harvey Milk vigils. And he looked up at seeing all the names on the cards, and it reminded him of a quilt, which was comforting, and you could make it together, it's communal, etc. And so it took him a while to hatch. And I think the first quilt pieces started coming together about a year later from that. And then the first, as was just shared, I think the first big showing of the quilt was on the National Mall in 1987. And now, of course, you know, biggest piece of art in the world, nominated for the Nobel Peace Prize, Emmys, Oscars, you name it. But it is all about both a memory and never forgetting, I would say, and celebrating the lives. And I think it's a powerful, powerful tool in advocacy. And I know that's part of why this group, SDES, and I think people are coming together, is we should not forget the power of that. And we should always remember, but we should always keep mindful of what more. And just as Dwayne was saying, there continue to be needs today in our LGBTQ, but across the community. AIDS is still very much with us. I don't think it's wrong to call it a pandemic. It's clearly still very present, both in this nation and really across the globe.
Yeah, and the quote, I believe it still has a really resonance today. Yeah, I would just think it's kind of been this, iconic piece of living history. I feel like that has been just a part of everyone. I feel like anyone who's a HIV/AIDS activist, or anyone who, no matter young, old, or in between, or however you define yourself or identify, you have an experience with the quote. Like, if you do this work, you have to in some way. It's at every HIV/AIDS conference I've been at, every World AIDS Day that I participated in, the quote is there, and I think it's important because it's something that also binds us all together. It's an experience. It's a reminder. It keeps us. And I remember when I first started in the field, one of the first things I was able to work on was a panel for the quilt to honor Black gay men in Columbus that have passed away. And we, even just amongst us, we were in our 20s at the time, we knew people that had passed away. And this was in 2010, as young Black gay men in Columbus, Ohio. And we put together a panel that we sent off to be a part of the historical record. And even today, we are still adding names. Like it's been said, it's not over. It's the age-related deaths have gone down, but people are still dying of HIV and AIDS today, or AIDS-related complications. So it is made very much a part of history, but it's also a living history for me.
Pretty much, I don't know what to say other than what's already been said. It's a very solemn piece of American history. Quilting, I have a quilt on my bed that my great-great-grandmother made. And so I think it also brought together all those people who could identify with just a symbol what a quilt meant throughout American history. And that connected them. And it made it possible for that group of people who would never have understood HIV and AIDS to begin to get it and not forget names, not forget, remember their names. So to me, it was just such a solemn thing. And still is. Problem with going last there is I had all that emotion from all of you. Good emotion and grateful emotion. And brought that memory back of my great-great-grandmother or great-grandmother, who was a very avid quilter.
Yeah. No, thank you for sharing your emotion and your vulnerability with us today. I mean, all of these are very difficult topics, and we really appreciate it. I know, Teresa, in our emails, you mentioned the community care aspects. And I think Dr. Pera and Jose have also talked about like the role of like other members of the queer community, like lesbians and drag queens who supported people with HIV/AIDS. So would any of you be able to provide some more information on that and kind of what that looked like?
Howard, do you want to comment on that?
Yeah, I mean, the Columbus AIDS Task Force was started by gay men and lesbians. Lesbians were a vital part of the Columbus AIDS Task Force. Without a doubt, we wouldn't have been able to function without their support. Kate Kitchen was the Assistant Support Services Director. She was on my business partner Affirmations early on, and she and Sadie Michael, and there were many lesbians and just allies as well Some of the local drag queens here in Columbus raised probably hundreds of thousands of dollars. Nina West and all of her family raised hundreds of thousands of dollars for AIDS. And, you know, again, that was instrumental in providing the kind of care that we needed.
They were doing it $1 at a time when it was really hard to raise money for HIV. I remember the first corporate sponsor was Lazarus, our hometown department store. And he was, like Teresa said, because of a relationship. We had a relationship higher up at Lazarus, so they came through for an event for the Columbus AIDS Task Force. And once they made that commitment, they opened the floodgates for other corporations to make it okay. But when it wasn't okay to raise the money, the drag queens were making that commitment $1 at a time, and they were critical. I have always had great respect for that community because they stepped up when others wouldn't or couldn't. Again, trying to be respectful of where people were. A lot of gay men were very afraid of being associated with HIV, so they made the decision to not do it. But the power of women, again, women stepped up. And Gloria J.T. Smith, one of the directors of the task force, was critical in changing the movement. And she did it. She got death threats for doing her work, for doing the right thing. So it's all fascinating how a community can thrive in the midst of such chaos, because he was pretty chaotic.
And people remember Rhonda Rivera, who would always bring her legal prowess to the floor whenever there was something, somebody's rights might be violated. She would threaten them in the ways that she could.
She was amazing. For those who don't know, she was really the first and foremost as far as gay, lesbian attorneys, and she was out there doing an amazing job.
Yeah.
And trying to hold everyone accountable. And
she
people paid attention to her.
She was a professor at Ohio State.
Right.
Yeah.
And
no,
she used to always say if you could always give money from the closet. You don't have to come out. Just give money from the closet. I don't care.
That's great.
She was tough. I would have been. She was tough. Yeah, she was great to work with. There was a lot of lesbian physicians also that stepped up. So there were the specialists like Mike that would provide care for HIV, but there were also a lot of primary care physicians which were afraid of doing the work. And there were several. I am blanking out on several of them, Teresa, but I know
Joan Wormbrand was one of them.
Perfect. Right.
Liz, I'm blanking out. Liz.
Right.
Yeah.
And Holly Barrows, I know, and yeah. But
So,
Joan is a great. Oh my goodness, she's still around and she's got little kids. Beth Trainin.
Beth. No, she's not still around. She moved to Florida.
Did she?
Last year, yes.
Oh,
in fact,
what do I know?
In fact, a lot of her patients came to Equitas.
Did they? Oh, what it is.
Yeah. Sudden increase in, they had to staff up for that.
Her kids probably went off to college or something like that. Yeah, wow, interesting. Yeah, I think there's no doubt that the entire LGBTQ community stepped up, but that lesbians were certainly really important in kind of keeping some of the glue together, and supporting and speaking up. You know, they both listened well, but they were committed to providing both hands-on care and support, but also standing up and speaking out when need be. So that's a terrific ally.
Yeah, I want to also just acknowledge many of the transgender and gender nonconforming activists that were also a major part of this work. I'm thinking about nationally, Sylvia Rivera and Marsha P. Johnson, who started the Street Transvestite Action Revolutionaries way back at the early part around the Stonewall period, even before the epidemic started. And then when the epidemic did start, a lot of trans folks, especially many who were sex workers at the time, were experiencing higher rates and felt they were being ignored in the data. And there's been this long kind of historical conversation about how trans women were kind of counted amongst the kind of MSM categorization within the surveillance data. And there's been a lot of work and a lot of conversation with governments around the world about how we make sure we honor trans folks in the data. I think now, just in the past 5 to 10 years, we're finally seeing that data being broken out, and we're able to really discuss and have a epidemiological conversation about the how HIV is impacting trans communities. But that came from a lot of work, a lot of trans folks, gender nonconforming folks who stood up and said we need to be counted as well. And so I just want to take a moment and honor so many brave trans and gender nonconforming activists who helped us get there.
Yeah, thank you for including that, Dwayne. That's a really important part of the conversation that often gets overlooked. We have about 12 minutes left, so I just want to open it up for some audience questions. Yes, we can take questions now. If anyone wants to put anything in the chat. I know one question I kind of have is, like I know Teresa, Howard, Michael, you've talked about like the stigmatization of patients within like medical settings. I just wanted to ask like how you kind of like challenge a lot of the fear and the stigma around the disease, like as a medical professional or a care professional in general.
You know, again, there was fear when it started because we didn't know enough. But as I said, within a year, there was pretty good evidence from the CDC, and they put out a guidance in September of, I believe, 1983, about how HIV was transmitted and what. We talked about the food, all right? Well, if you drew a blood sample from somebody, the lab becomes frightened to actually even do the test on it, because they don't know whether something is going to jump out at them. And so really is really critical for the CDC to get this out to the community, the physicians, and as early as they could to kind of relieve, yes, you can serve them food. Yes, you can draw them their blood. Yes, you can manage to do the blood test on it. And actually, this is hard to believe, but when I was growing up, there were no such things as gloves on anybody. I mean, the dentist never wore it. It's even hard to imagine that a dentist didn't wear gloves. But that's the way it was. And so, the CDC had to change the culture. And it was really important. It was really important to get out in the community and talk about these things and what HIV was and what HIV wasn't, and talk to the medical community. And I viewed that as kind of my major job. And I think I'd been to every small hospital within 50 miles of here. But it was critical to deal with that reality, that it wasn't going to, you could take care of patients without fear. You had to be careful. You had to do what they suggest. It's like COVID. You have to do what you're supposed to do, but you can do it.
And I would add to that Mike was really the leader in this community and really did a lot of talking around the state, as he just said, because it's one thing to have the guidance, but it's another thing to have the practice. And so Ohio State was the place for a long time. Mike was the doctor for a long time. But to have that move out took a lot of care and attention. And Mike was a big part of that. There was a huge infrastructure then built around that. Remember ECATEC, the East Central AIDS Education and Training Center, which little pieces of it still kind of exist, I think, in some ways, maybe. Right. Yes. But Mike was the main speaker, but he was out there, and I know that, you know, we tried to get primary care physicians, and they're like, no, I don't think so. And then trying to get community health centers. No community health centers in Ohio would see patients, and so working with them, and Mike would just, you know, be so giving as far as his time, and then being willing to take consults, because there were some primary care providers who were willing, but they were very concerned about all different kinds of things. And so again, Mike was very willing to consult with them every step of the way.
Yeah, I think, you know, obviously working with the health department, as we talked about Tom Halpern at the state, he was always a big worked at this. And again, in the gay community too, I can't say that there was stigma among the gay community as well. There are certain who didn't be around people, but eventually, once we learned more, it gradually changed. Things change as people see what is the truth.
And I think the Columbus AIDS Task Force did a lot of education in this community, certainly to help people understand what the facts were. And at that time, people really did listen to science. And it was very helpful to know what the science was and to know that we could trust the CDC and trust their guidelines. And that made a huge difference.
Yeah, right. Among the community groups, certainly CATF did a lot in the schools and wherever they were. That was aside from being buddies and giving direct support, that was a major emphasis of theirs to calm the hysteria and get the facts out. That they deserved a lot of credit for that.
And I think the professional organizations, OPA, the Ohio Psychological Association, and the Mental Health Association, and the American Psychological Association, all were very involved early on in the AIDS crisis, that from helping psychologists to understand and how to really energize people to provide the very necessary services that were so critical to helping support the mental health of folks that were so challenged by this disease.
And actually, Dr. Fauci, who's well known now by everybody, he was the first person to take and put potentially infected people on his research committees. He was the first national scientific leader to involve the community in helping to make the research agenda. And still, it is the model for all other institutes. National Institutes of Health is the National Institute of Allergy and Infectious Disease, because he put Mark Harrington on that committee and Martin Delaney, people who very smart, very strategic individuals were put on his scientific committees to help design a research program that would be accepted by the community. And actually, whether you know it or not, it's really primarily Tony Fauci who brought us where we are today in terms of the science for HIV. He pushed the agenda for 25 years to get to the point where we are now with the treatments.
Sort of funny, since he's obviously become such a household, at least a name, and in many places a household hero, but he's been a hero in this since the very early 80s.
Right.
And it's amazing for a guy who's 80 years old, and yeah, he's pretty remarkable.
I mean, he still funds cure, you know, he funds cure research, he funds the vaccine, he looks for what will have the biggest impact. Or he doesn't personally fund it. He steers his institute's monies to those endeavors.
I know we just have a couple minutes left. I haven't seen any other questions, but is there anything any of you would like to share before we close off?
I just want to comment, and maybe Howard, Don, Jose, Dwayne, Mike might want to comment too. There's a comment, actually it's from Bucky or from you, Maura, but that it's upsetting that people in healthcare were so resistant to provide for patients when we knew the routes of transmission. I get that, and yet I think we have to always remember that people are people, right? And there was a lot of fear and a lot of, even if we said we knew the routes of transmission. I mean, we're seeing that today with COVID, and you can tie in all the other things that we've said. So I agree. I think it is distressing, and it took a while, and it took a lot of hand-holding and support. And if you think about bell-shaped curves, maybe that's just what it was. And we had to work through that bell-shaped curve to get everybody where they needed to go. I would say ultimately, we've got to a much better place, both in this town and in this state and across the country, which is a good thing. But that doesn't mean that there's still not shame and stigma, both connected to HIV and to other health conditions. And obviously we're seeing now the terrible stigma associated with persons of color, and especially Asian descent, connected to COVID. So we've got a lot of things that we could work through in this country. But again, I think it's distressing, but I also think it's real. I mean, people are people.
And Dr. Long, to uplift on the other side of that, I remember going to Ohio State, and what was the floor? Was it the 9th or the 12th floor?
11th. 11 West.
Yeah, that was a very difficult place. That was the infectious disease floor. And we took care of so many friends there. But the staff was amazing. Yeah. I mean, imagine that those nurses were taking care of people dying every single day, 24/7. They were amazing.
Not surprisingly, they won when the people in the marketing, whatever, were looking for nursing wards, through the hospital. There was probably 20 or 30 wards, nursing units. That was the one that won the award for the best nursing unit.
Yeah, I remember there was a gay guy. There was a gay guy that worked there. Very quiet. There was Laura, a nurse, who was fantastic, a lesbian. I mean, there were a lot of really good people that, again, the people that went into this field, much like the people in your panel here, went because they cared. They could have chosen other careers, and many of them stepped up and did amazing stuff. So when other ones wouldn't. So that's the thing that I always think of the most. We saw people at their best, sometimes at their worst, but for the most part at their best.
Good place.
I think we're getting nearer a vaccine. I really do.
Yay!
Yeah. Not tomorrow, but it would not surprise me to see one in 3 years.
You think the work on COVID, Mike, is going to be a partial game changer that way?
Well, yes, I think. Well, I think we will probably see a Moderna HIV vaccine within 18 months. Now, it's more complicated than that, but I think they did this trial where they gave monoclonal antibodies, like we give monoclonal antibodies to treat COVID. They have monoclonal antibodies they have developed to HIV that are broadly neutralizing anyhow. they did a big test to see if you could give those to people and if they would be protected. And in fact, they were. And we have an idea now what it takes to protect. We have a firm understanding now of what it would take to protect somebody from HIV. We never had that. And so when you test a vaccine, you'd have to, like the COVID, you'd test it on 30,000 people. No, on the HIV vaccines, they were usually 5,000 or 6,000 people you had to test it on, only to find 3 years later that it didn't work. Now we have ways that we can measure, we have measurements that we can make after you give it to 50 people that go, well, this isn't any good, or this looks promising. And so I think that will really expedite the development of these new vaccines, like from Moderna and other places. I'm excited. I really do think we'll have one probably on the market in 5 years.
So I would say there's so much to think through, to both remember, and it's been amazing to spend some time remembering with these amazing people. So I'm honored to be a part of this group. But there's also, we can't forget, there's obviously still much to be done, and having a vaccine would be a super, super powerful tool.
For the world, yes.
For the world, absolutely. But we're all going to need to keep working at it. And I do think it's about supporting each other, and it's about educating each other, working together. Those aren't going to stop. Those needs are going to continue.
I'm sure Mara is being polite and not telling us that we're out of time. I'd like to say thanks to all of you. It was good to see your Zoom faces today. It was really fun.
Thank you. Thank you,
I
Mara.
wanted to thank everybody too, and just thank you for your passion and your courage. And we really can do all this together. And so thank you.
Yeah, thank you for getting us together.
Yeah, no.
It's been an honor to be part of this conversation. Thank you.
Oh.
Thanks to the students. Go out and change the world. We need you.
Oh, thank you so much, everyone. Yeah, it's really been wonderful hearing from you all, both the tragic stories, but also the empowering stories about like the people in healthcare who you've worked with, the people in the community who you've worked with. And we're really grateful to have you here today to talk about those experiences. So with that, we can end the panel for now. If any of you would like to place your contact information in the chat so that people can reach out to you with any questions, that would be great. And we are also continuing talks from 4:45 to around 7:30 today.
Wow.
So we're gonna take a quick 10-minute break, reset for everybody, go take care of yourself, get a snack, and we will see you all in 10 minutes from now at 4:45. But please feel free to chat in the comments, and we'll see you soon.